सब चलता नहीं है, प्रॉपर चलाना पड़ता है। आरबीआई कहता है जानकार बनिए, सतर्क रहिए।
Come on boys, let's go practice.
अरे रुक यार, मेरे बैंक अकाउंट में गलत एंट्री का प्रॉब्लम हो गया है।
अरे तो बैंक को कंप्लेन करना।
बैंक को लिखे 1 महीना हो गया है, बट वो गूगली पे गूगली डाले जा रहा है।
तो आरबीआई के बैंकिंग लोकपाल को इन्फॉर्म करो।
रुक मैं समझाता हूँ। जैसे क्रिकेट में थर्ड अंपायर, वैसे ही आरबीआई का बैंकिंग ओम्बड्समैन। आरबीआई कहता है अगर बैंक आपकी कंप्लेंट को 1 महीने में नहीं सुलझाता तो आरबीआई के बैंकिंग ओम्बड्समैन में कंप्लेन करो। यह आरबीआई का आसान तरीका है आपकी कंप्लेंट सुलझाने का, और वो भी फ्री।
समझे?
आरबीआई कहता है जानकार बनिए, सतर्क रहिए।
And importantly, wash your hands regularly with soap. All right, then let's get started. First up, the headlines. The centre approves a COVID-19 emergency. Drugs. It is fully funded by the central government and will be implemented in 3 phases till March 2024. The group of ministers on combating COVID-19 discusses about having separate hospitals for coronavirus patients. The central government says no need to worry over personal protective equipment. 20 companies are manufacturing PPE kits. 49,000 ventilators are being purchased as well. Prime Minister Modi replies to the thank you note from US President Donald Trump, says times like these bring friends closer. President Jair Bolsonaro of Brazil also thanks India. Prime Minister Modi speaks to President Moon Jae-in of South Korea. As the world continues its fight against COVID-19, coronavirus cases near the 15 lakh mark with over 88,000 deaths. United States, Italy and Spain report maximum deaths. All right, let's get you all the news from India first. The federal government has approved a comprehensive package for assistance to the states in the fight against COVID-19 pandemic. Called the COVID-19 Emergency Response and Health System Preparedness Package, it is a 100% federally funded program aimed at enhancing the infrastructure in the states to meet the coronavirus epidemic challenge.
ये एक स्पेसिफिक पैकेज है, कोविड-19 इमरजेंसी रिस्पांस एंड हेल्थ सिस्टम प्रिपेयर्डनेस पैकेज। ये अप्रूवल हो चुका है। इसके लिए हमने आज ही स्टेट्स को लिखा है कि इस पैकेज के द्वारा 100% सेंट्रली फंडेड स्कीम है ये, जिसके द्वारा सेंट्रल गवर्नमेंट स्टेट गवर्नमेंट्स को सपोर्ट प्रोवाइड करेगी इन टर्म्स ऑफ स्ट्रेंथनिंग देयर हेल्थ सिस्टम्स, सपोर्टिंग देयर प्रिवेंशन प्रिपेयर्डनेस एक्सरसाइज, प्रोक्योरमेंट ऑफ एसेंशियल मेडिकल इक्विपमेंट, कंज्यूमेबल्स और ड्रग्स, और साथ ही सर्वेलेंस एक्टिविटीज इंक्लूडिंग अपग्रेडेशन और लेबोरेटरीज। और इसके तहत स्टेट्स पीपीज N95 मास्क, वेंटिलेटर्स या कोई और भी सप्लाईज हैं वह भी खरीद सकते हैं, जिसको टोटली सेंट्रल गवर्नमेंट फंड करेगी। साथ ही हम कम्युनिटी सर्वेलेंस एक्टिविटीज के लिए भी इस फंड को इस्तेमाल कर सकते हैं, हॉस्पिटल के अपग्रेडेशन के लिए भी इसको यूज कर सकते हैं, एम्बुलेंस के लिए यूज कर सकते हैं।
The government also says that supplies of personal protective equipment or PPEs and ventilators have begun. Orders for 17 million PPEs have been placed on 20 domestic manufacturers, supplies of which have already begun. The government has also placed orders for 49,000 ventilators. It says there is no need to panic as far as availability of essential equipment is concerned.
PPE is mix of different components जैसे boots, N95 मास्क, कवरऑल और साथ में हेड गियर, उससे संबंधित कंपोनेंट्स भी उसमें होते हैं। तो केवल जहां पर हमारा हाई रिस्क होता है वहां पर पूरा कंपोनेंट यूज होते हैं। बाकी जहां पर हमारा मॉडरेट रिस्क होता है वहां पर N95 मास्क या ग्लव्स सफिशिएंट होते हैं। इसी तरीके से अगर कोई सफाई या ट्राइजिंग से रिलेटेड काम कर रहा है तो वहां पर N95 मास्क और ग्लव्स सफिशिएंट हैं। केवल इमरजेंसी रूम में, केवल मॉर्चुरी रिलेटेड एक्टिविटीज में, केवल जहां पर एक्चुअल में लैब सैंपल कलेक्ट हो रहा है वहां पर ही फुल कंटेनमेंट ऑफ पीपीई की जरूरत होती है। तो आपके द्वारा मैं सब लोगों की दृष्टि में लाना चाहूंगा कि किसी भी तरह का कोई भय न रखें। सफिशिएंट क्वांटिटीज गवर्नमेंट के लेवल पर अफोर्ड कर स्टेट्स को प्रोवाइड की जा रही है।
All right, we'll get you all the COVID-19 updates from India and the world. But before that, we'll get you the numbers as far as India is concerned. Now, there are 5,218 active COVID-19 cases in India as we speak. 169 people have died so far. And in India, 477 persons have either been cured or discharged. That's 477 on your screens. And there is one migrated case, so the total comes to 5,865. Now, the maximum cases have been reported from Maharashtra at 1,135, followed by Tamil Nadu at 738. Delhi comes third at 669 cases, and Telangana fourth at 442 cases. Now, coming to the maximum deaths, 72 have been reported from Maharashtra alone, 16 deaths each in Gujarat and Madhya Pradesh. 9 people have died in the national capital Delhi, and 8 deaths each in Punjab and Tamil Nadu. All right, now to the world at a glance. Almost 1.4 million cases worldwide, and 85,586 deaths across the world. That's the latest figure. And in one day alone, on 8th April, more than 73,000 cases were reported worldwide. Coming to maximum deaths, maximum from Italy at 17,669, followed by Spain at 14,555. The US is at third place with more than 12,000 deaths so far. And more than 10,000 have been reported from France, again in Europe, and in the UK, more than 7,097 as we speak. Moving to Iran, almost 4,000 deaths. And finally, China, the death toll is almost stagnant at 3,344. Right, moving on, the government in partnership with the private sector has launched a contact tracing app called Arogya Setu. How exactly does this app help in the fight against COVID-19? My colleague Amrit Pal Singh spoke to the Principal Scientific Advisor of the Government of India, Professor Vijay Raghavan. Listen in.
I have with me Professor Vijay Raghavan, the Principal Scientific Advisor to the Government of India, to talk about this Arogya Setu app. Why is it important for people to download this app? What exactly does this app do?
To understand this app, we must understand that we have to get one step ahead of the virus. And the only way to get one step ahead of the virus is to test and to trace. And this app does the tracing part. It does the contact tracing, the tracking of people who are positive, warns those people who are close to them, and asks them to protect themselves in a variety of ways. The important reason for this is a very simple one. We have learned enormously about this virus over the last few months. We know that people without any symptoms can transmit the virus. And this is something which is important for us to know. Unlike other viruses, this virus can infect people. They don't have to show symptoms, and they can infect others even when they don't show symptoms. Therefore, if you follow only infected people and isolate them, the virus will always be ahead of us, because infected people without any symptoms are infecting others. This app allows you to know who are the people close to an infected person, and then goes back in time and says, these are the people who are close to that person the previous week, and identifies them and protects them also. You download the app, then you have to do a self-assessment, your age, your gender, your background, your medical background. Do you have diabetes, hypertension, or you're normal? Have you had an international travel recently, and so on? And then the app very rapidly gives you an assessment of your status. It tells you how careful you should be. and it gives you a green color or an orange color, depending on where you've been and what.
This is risk assessment, that how prone am I to the COVID-19 virus.
This information is stored on your phone, and also when you turn on your Bluetooth and GPS, as others use the app for close by, then if any of them later on become positive or are at risk, then your status is updated and you get a alert about what exactly you need to do.
Or what about the concerns of privacy?
The concerns of privacy are protected. The app is very secure, and we've done huge number of security tests. But also, the kind of data it gathers is not proximal data in terms of what is going on inside your household and who's close to you in the household and so on. It does it at a slightly larger level, at a mohalla level. And of course, when something happens at a mohalla, because it has your telephone number, and it has the telephone numbers of the people in the mohalla who are using the app, then they can be tracked and helped. So there'll be no invasion of your privacy at a fine level. There are, of course, whatever privacy information goes into the app, that will be very protected. It's not going to be shared with anyone at all except for fighting COVID-19 disease. So you're completely safe.
All right, time now for the Ground Zero segment, in which we get you reports from our correspondents across the country. We begin with Bengaluru. Now, Karnataka is in favor of lifting the lockdown in districts not affected by the coronavirus. Over 12 districts have not reported any case of corona so far. Therefore, the government is contemplating on lifting the lockdown. Aisha Khanam reports.
Karnataka Chief Minister B.S. Yediyurappa held an emergency cabinet meeting at Bangalore today. The cabinet examined the recommendations submitted by the expert committee headed by eminent cardiologist Dr. Devi Shetty. The committee is of recommendation that the lockdown can be lifted in phases, and also the committee has recommended that the schools and colleges be closed till June. Besides, the committee also says it will be safe for the small businesses to resume in phased manner. The committee has also suggested that the non-AC restaurants and shops can be opened for businesses, and the inter-district transport can also resume in a phased manner. Although a final decision was not taken at the emergency cabinet meeting, but the Chief Minister has announced that a final call on lifting the lockdown will be taken after consultation with the Prime Minister. Aisha Khanam, DD News, Bangalore.
All right, with the COVID-19 crisis getting severe, with the number of cases going up each day, governments everywhere are taking various measures to curb the numbers. The municipal corporations of Mumbai and Pune have made it compulsory for people to wear a mask in public places. My colleague Shishir Shelar reports.
Maharashtra has recorded the highest number of corona positive patients. That's the reason the state government looked quite worried at this point in time. Well, of course, to penetrate the health services in the grassroots level, the state government, along with the Indian Medical Association, will establish Raksha Clinic at all the district and taluka level. That's what the state government have decided, to penetrate all the health services in the remote areas. Along with that, the state government is also focusing the economic impact of corona on the state economy, and that's the reason the cabinet meeting, in today's cabinet meeting, the government have decided to form two committees. One committee will consist of all the industrialists, economists, as well as the retired officers and the officers from the finance department, the state finance department. And the other committee, the second committee, will consist of the Deputy Chief Minister, Finance Minister, and the other ministers from the cabinet. And both these committees will discuss and review the impact of the corona on the state economy and what needs to be done in future so that it can tackle the menace of this on the economy, and also to revive the economy. That's also been decided by this committee. In the future, they will take action on it. The third important aspect is that the containment zone in the state. As we know that Mumbai is being the epicenter because we have seen the maximum numbers recorded in Mumbai, and that's the reason the containment zone in this area, the government is more focusing on providing best healthcare services in these areas, as well as the government is telling people who are residing in these areas not to come out and maintain the social distancing, and that's the reason most of the containment zones, the government have already established a small clinic there so that people residing in this area, they can also test themselves. At the same time, those who have been found positive, they have been either home quarantine or been sent to the hospital here. Obviously, the main intention of the government is not let the numbers increase of the corona positive patients, and that's the reason these ample measures being taken by the state government. For DD India, Shishila.
So that was the news from India. Now shifting gears, here's how some countries are faring on what I call the COVID-19 meter. Take a look. All right, time now for a DD India exclusive. Foreign Minister Abdullah Shahid of Maldives speaks to DD India about the situation in his country and the ties with India. Take a listen.
Maldives, we have had 19 confirmed cases of COVID-19. All those cases have been imported. We are fortunate not to have any community spread at this time. Government has taken very strict steps, stringent policies to make sure that there is no community spread. We are blessed to have islands in the country. Individual islands are quarantine facilities. The situation, however, on the economic front is dire. The economy has been the first victim of COVID in the Maldives. Unfortunately, we have no tourists arriving in the country. Tourism sector is devastated. Fisheries sector is devastated. And the entire economy is suffering. We are very grateful for all the countries who have been helping us. I should say that India has been exemplary in its assistance to the Maldives. India has very kindly helped us in evacuation of Maldivian students from Hubei, looked after them in Delhi during their quarantine period, and delivered them to the Maldives. India has given us grant of over 5 tons of medication, which are urgently needed. India has also helped transfer a number of medical orders that have been placed and stuck in different cities of India. The Indian Air Force and the military helped transport it to the Maldives last week. India also has very generously assured us that the lines for essential commodities will continue to be open. India has been an outstanding and exemplary friend.
Right, moving on. President Jair Bolsonaro of Brazil thanked Prime Minister Narendra Modi and the people of India for the timely help to his country in the times of crisis by supplying hydroxychloroquine. Take a listen.
We have more good news. As an outcome of my direct conversation with Prime Minister of India, we will receive raw material by Saturday to continue our production of hydroxychloroquine so that we can treat patients of COVID-19 as well as of lupus, malaria and arthritis. I thank Prime Minister Narendra Modi and the people of India for such timely help to the people of Brazil.
All right, now take a look at what else is making news around the world in our World Wrap segment. The WHO Director General Tedros Adhanom Ghebreyesus has urged the world to stop politicizing the novel coronavirus that sweeps across the globe. Answering a question from the media about US President Donald Trump's threat to freeze US funding to WHO, Tedros said his message for the world at this moment is unity and solidarity instead of politicizing the virus. He stressed two things to the world: national unity and global solidarity to defeat the virus. Hong Kong announced relief measures worth $17.7 billion to help businesses and people crippled by the coronavirus to stay afloat as the city joins global efforts to cushion the impact of the pandemic. Hong Kong Chief Executive Carrie Lam pledged at a news conference to take a pay cut of 10% for a year. She said the government would pay 50% of workers' salaries for 6 months, with the monthly subsidy for each worker capped at about $1,100 US. The Chinese Health Authority has said it received a report of 63 new confirmed COVID-19 cases on the Chinese mainland on Wednesday, of which 61 were imported. 2 new domestic cases were reported in Guangdong province. 2 deaths were reported in Hubei province on Wednesday as well. A total of 17 new suspected cases, 16 imported ones and 1 in Heilongjiang province were reported on the mainland. The northeastern Chinese city of Shufenhe, a port city close to the border with Russia in the Heilongjiang province, has locked down all its communities, subject to closed management starting from 8th April to cope with the increasing number of imported COVID-19 cases. It was reported that the city of Shufenhe has recorded 84 confirmed cases and 127 asymptomatic cases over the past 3 weeks. All the land crossings between China and Russia have been closed for the time being. Apart from strictly controlling travel, the communities will take over the people from overseas under collective quarantine and make them stay at home for a certain period of time. Australian police said it has taken the black box from a cruise ship which disembarked hundreds of passengers infected with the coronavirus in Sydney as part of a homicide investigation into the country's deadliest infection source. The investigation got underway as the Australian authorities said the rate of new coronavirus infections hit its lowest number in 3 weeks and began arranging more flights to bring home citizens stranded abroad. The Ruby Princess cruise ship, owned by Carnival Corp, has become a flashpoint of public anger in Australia after authorities granted the ship permission to disembark its passengers last month without any health checks. Spain's Prime Minister Pedro Sanchez says his country is close to the beginning of a decline in the coronavirus epidemic. He urged all political parties in the country to join a pact for national economic revival after the health crisis. They were to vote on a 2-week extension of Spain's state of emergency, which would keep people at home until 26th April. The government's proposed new economic deal is inspired by the Pax of Moncloa, signed in 1977 after the death of dictator Francisco Franco, to transform the state-run economy into a market economy for newly democratic Spain. It seeks to unite the splintered political landscape and also encompass unions, companies and regions behind a common economic reconstruction policy. And that's a wrap on this special broadcast. We leave you with visuals exclusive to DD India. You can see how the city of New Delhi looks from atop the Pitampura TV tower. Our camera crew shot the quiet, peaceful view of a New Delhi under lockdown. The city woke up to another day. Thanks for watching. Bye-bye.